Hello, everyone. I'm Dr. Sal Pacella. Welcome to the Beauty and the Beast podcast. I'm sitting here with my good friend, Sam Jejurikar. He's the president of the Dallas Plastic Surgery Institute. Sam, how are you doing today?
Doing so well, Dr. Pacella. How are you this morning?
Fantastic. Well, today we're going to have a very special topic. We're talking about facelifts at 40.
Yes.
The truth about aging and the timing of surgery. So this is a fantastic topic. You may have seen this in the media over the last several weeks and months about celebrities having facelifts and facial rejuvenation procedures throughout their life, and also starting at a younger age. Sam, tell me about your philosophy of facelifting for the middle-aged patient.
Is 40 middle-aged? Just to be clear, okay.
For you, it is.
So I think there's a few things. When it comes to celebrity plastic surgery, let's start with that first. There's been a lot of talk about Kris Jenner, who's confirmed to have had a facelift. There's speculation about Anne Hathaway or Christy Brinkley or Bradley Cooper, or just lots of celebrities and people speculating what they may or may not have done. And I don't think you and I are the sorts that necessarily spend a lot of time looking at celebrities and trying to figure out what they've had done. I know lots of people like to do that. But it does dovetail to a really nice discussion about what's the right type of facelift. You know, there's been a lot of talk in the last year or two about deep plane facelifts. You know, deep plane. It's a more advanced technique. It's a new technique. Everyone needs to get a deep plane facelift. Well, it's a technique, as you and I both know, that's been around since the 1970s. Dr. Hamra, Sam Hamra, came up with it. It's not a new technique at all. But I can't tell you the number of times that my front desk staff will tell me that, you know, someone's calling saying they want a deep plane facelift, which is the right thing for some patients, but not all patients. I love the fact that Kris Jenner, actually came out and said who did her surgery, because we know who the surgeon is, and we know that he's a disciple of Dan Baker, who's one of the guys that I did my fellowship with, and and it's a much more limited operation, but she looks amazing. So I guess my philosophy, getting back to your question, is we need to tailor the procedure to the patient. We need to understand the reasons why they have why they've had facial aging, and then we need to treat them individually.
Right.
What do you think about that?
Well, I think the really interesting question is the age of starting facelifting and facial rejuvenation. And, I can tell you, I live in a older community. La Jolla is a lot of retirees. And, many times we have patients come in to see me in the office that are in their 70s and 80s and have had a tremendous amount of sun damage throughout their life, and they haven't done anything. And when they come in, I have a very frank conversation with them. It's really difficult to take somebody who's 80 and make them look 40. You can make them look 70 or 60, okay? But it's just simply not possible to turn the clock back that much. And I think the great thing about what we're seeing in trends in facelifting is that when you start doing those at age 40 or 50, you can really turn that clock back to 30 or 20 even, right? And that sort of dovetails with what you're saying as far as the mini facelift, the different techniques. Does every 40-year-old need a deep plane facelift? No. It's tailored to every single patient.
Yeah, it's sort of that concept of rejuvenation versus prejuvenation, right? Where in the operating room yesterday, I was having a conversation with the staff saying, have you guys seen how great Christy Brinkley looks? And I have no idea what she's done, but she's 71 years old. Of course, two of the ladies in the room said, who's Christy Brinkley? Which made me feel really old. But so once I explained who she was and they looked her up, they're like, oh my God, she's 70 some years old. And it's the concept where if you take care of yourself throughout the entire range of your life, you can actually achieve that look where you would look like you're in your 40s. And I think you would agree that if you take someone who's been actively maintaining their appearance, they can look, very youthful.
Right. And, it's interesting that you say that about maintaining your appearance. And I'm gonna take it one step further in maintaining your health. So a conversation I have very frequently with patients that come in at, say, 60, 70, when they're looking at facial rejuvenation, I say, sometimes the problem is as you get older and you stay in shape, it's a cruel trick of nature, right? Because you lose fat on your body, but you also lose fat in your face, right?
Yeah.
and that makes you look hollowed out. It makes you look gaunt. It makes you look haggard. And so part of the philosophy of doing a good facelift, I think, particularly in the 40 and 50-year-old range, is adding volume, adding fat. Tell me a little bit about that in your
Yeah,
practice.
I think that's a perfect description of what's happening. So, why do we look older? We look older for predominantly two reasons. What we always focused on for years, classically in plastic surgery, was the laxity or the looseness that can happen both to the underlying foundation of the face, which is called the SMAS, and to the skin. But there's been a huge just shift in the realization that over time we lose volume in our face, and we're seeing it a lot with medications like Ozempic. You know, you've heard this term Ozempic face, where when you lose volume in your face, you look old as well. And so I think that's the important thing to explain to patients. There's not a right age to get a facelift. It's when the anatomic changes get severe enough. The youngest patient I've ever done a facelift on is 18 years old. A patient who lost 100 pounds with Ozempic, who had massive deflation of her face and had substantial sagging of her, of her neck and her lower face. The oldest patient I've done a facelift on is 93 years old. And so there's a huge range with which it's appropriate.
That sounds great. Well, why don't we take the opportunity to look at a few patient cases? What do you think?
I think that's
So,
right.
so this patient is in her late 40s and she lost a bit of weight, not through Ozempic, but through diet and exercise. And a couple things we can see in her face. Tremendous amount of fat loss right in the temple area. And to me, that's an area that is oftentimes ignored, but easily noticed.
Hmm.
And so part of the philosophy of rejuvenating the face is adding fat into those strategic areas. Specifically in the temple region, I like to inject it deeper into the temple. It's really nice and smooth. And you can see it's all about adding volume, but also suspending.
Yeah. I think it is so critical to add volume back. It is one of the telltale signs of aging for sure. And I think what you'll notice is as you see the sort of the various before and afters that they're showing that are showing while we're talking here, none of these patients have the same techniques. I know you do a deep plane facelift on patients. I'll do a deep plane facelift on patients. I know you'll do a SMAS plication on patients, which is which is basically just tightening the tissue. I know there's a different indication for every patient. The vectors that you're pulling the patient is different from patient to patient. The amount of volume you add is different from patient to patient. What you do with the underlying foundation is different. You want to take a more bespoke approach as opposed to just saying that one facelift fits all.
And it's interesting. The nomenclature is all over the place when you look at it
Hmm.
online or in celebrities. Patients come in and they say, you know, Doc, I just want a mini. I just want a mini facelift. But if you look, their neck is loose. You know, the side of their face, the jowls are loose. So, to you, what is a mini facelift?
That's a great question because a mini facelift to me is a description of the incision and the length of the incision. To me, a mini is the same thing as a short scar facelift, an incision that's predominantly dealing with the midface and the jowls, but not so much dealing with the neck. So it'll be an incision that typically extends to some degree in front of the ear, either up into the temple, maybe underneath the sideburn, but not very far behind the ear. What you do with the underlying foundation can range with a mini facelift to being very extensive to being nothing. And that leads to another conversation.
That a
Okay.
mini facelift is done in a small patient? It's any facelift done in a small patient?
Actually, no. That's a mini tummy tuck, but that's a different issue. But really, the other thing is, I don't know how many patients will say, "Am I going to get a deep plane facelift? I want a deep plane facelift." What is a deep plane facelift, Sal, and how does it vary from other types of facelifts that somehow manipulate the deeper foundation of the face?
Right. So I think it's important to understand the anatomy of the face, right? So the face isn't just one piece of skin, it's underlying subcutaneous fat, and then it's another layer behind it, which is the SMAS layer. That's a muscular layer that goes all the way from your neck all the way to the top of your crown, right? And so the deep plane facelift concentrates the technique on suspending that deeper muscular layer. Now, various surgeons do this various ways. Some lift up the skin and the SMAS. Some go right underneath the SMAS and suspend it. And that's exactly what we're talking about, a tailoring. You know, many times what you see in, you know, our general plastic surgery community is the composite facelift, or the facelift that is just purely underneath the SMAS layer. And to me, sometimes that doesn't fit for everybody, because regardless of how much you tighten the SMAS, it's not going to tighten up the skin around it. So you almost have to tighten up both layers. So it's it's a way of performing the technique to get a deeper pull and better longevity. And to me, it works fantastic, but it's not for everybody.
Yeah. And I think, just to kind of dovetail on what you're saying, a deep plane facelift is not the only type of facelift that manipulates the deep plane. It
Correct.
is a composite facelift in which the skin and the deeper soft tissue are being pulled in the same direction. And I think patients need to know that. It's important to get long-term results to suspend the deeper layer, the SMAS, but there are different ways to adjust the skin for the patient. So, Sal, a common question that that patients will ask me is, well, how long is it going to take me to recover from my facelift? What do you tell them?
Well, I say life is not like social media. You see a lot of these befores and afters on Instagram, and immediately the patients look fantastic. And in fact, that's exactly what we were talking about, Kris Jenner, right? She immediately looked fantastic when her facelift was just 3 weeks ago. It's important to understand that she has an army behind her of makeup artists and hairstylists, et cetera. So a facelift does take a little bit of time to recover from, right? And so I would say, when you're talking about lesser facelifts, so mini facelifts or minimally invasive facelifts, you know, it's a few weeks of recovery. When we're talking about a deep plane facelift, it's oftentimes 6 weeks. I tell patients, in a deep plane facelift, if we're doing everything, the critical time is about 3 months. You start getting better after about 3 months, but you're not better until about 6 months later. And you have a very interesting thing you tell patients here. You learned from a fantastic surgeon. What do you tell them?
So the line I tell every patient, which I stole from Dr. Pacella, which he did,
Which I learned from Dr. Lou Bucky.
is that you can eat at your third favorite restaurant 3 weeks after surgery. Meaning that at about 3 weeks, people that don't know you will probably just think maybe you had some bad plastic surgery, some bad filler. They won't really think twice about it. People that know you will still recognize that you had something done. The other line that I have stolen is from one of our mentors at the University of Michigan, the incredible plastic surgeon, Meshack Haskell Newman, who everybody called Hack Newman, which isn't the best
Not
name
the
for
best.
an aesthetic surgeon, but an amazing aesthetic surgeon, was you're going to have some degree of buyer's remorse. I tell them the buyer's remorse is going to last for about 2 or 3 weeks, because you look horrific right after a facelift. Doesn't even matter if it's a minor one. You look like a different person, like a youthful alien in some ways. And so it's important to just recognize there's going to be a period of emotional trauma, usually peaks days 3 to 5. By about 14 days, you start to see yourself and you see the results of the surgery. And by 6 weeks, you're going to be in love with your results.
And it's even a bigger recovery if you have fat placed in the face too,
Absolutely.
right? That causes a tremendous amount of swelling. And so I think the important takeaway message here is, it's not an overnight surgery. It's not it's not a lunchtime facelift, right?
Absolutely. So then my last question for you is, okay, and I know you've had this scenario. We all have this scenario. You'll see a patient who comes and see you. She might be in her late 30s or early 40s. She has all of the classic signs of early facial aging. And she'll say, Dr. Pacella, I feel like I might be too young. All my friends are telling me that maybe I'm too young to be getting this done. What do you think? Like, would I benefit from getting a facelift? How do you answer that question to someone who you see anatomic changes in, but might be afraid they're too young to actually get a facelift?
So also a fantastic question. I think, 20, 30 years ago, if you talk to some of those plastic surgery professors, they would never do a facelift on a 30 or 40-year-old, right? They would wait till they're 70 or 80. But what I'm seeing now is there is value in suspending the tissue when it's younger and when we have to do less. And I honestly think that there's an exponential improvement as you get older. So somebody who has a tighter face at age 30 or 40, they're going to look fantastic if they ever have to do a revision at age 60 or 70.
That's right. Yeah, I think the notion that you get one facelift in your life as a patient is not true in the 21st century. There are patients that get multiple facelifts. If you are doing them every 10 to 15, 20 years, they're an easier operation and you can maintain a youthful appearance for longer.
So we're both in our 50s, I think, right?
We are.
Yeah, it's time. Is it time?
It was actually time for you about 10 years ago. I was meaning to talk to you about that.
Well, it may not be time for a facelift, but it is time for the end of our podcast. Well, everybody, thanks for joining us on the Beauty and the Beast podcast.
Cheers.